Hey guys, welcome back to my channel. Today I want to tackle a very frequently asked question, but somewhat complicated to answer, and that is treatments for dark circles. And this is a question I get asked all the time on my social media, and I kind of strain from answering it because there's so many nuances, but I thought, you know what, it's time to make a video to help you guys better understand why there's no simple treatment and there is no one best eye cream to treat dark circles. But from a dermatologist perspective, the causes, how we evaluate, and what recommendations we can make for you and to help improve dark under eye circles. So keep watching. So the causes of dark under eye circles are many, but technically categorized into 4 different types. Pigmented type, which is due to excessive pigment production. Vascular type, which is due to prominence of the blood vessels underneath the eye, and that's mostly due to, the thinner eyelid skin. 3, structural, and that has to do with just anatomy of one's face and the hollowness sometimes that may occur due to the facial structure and how the light reflects off of the face and giving that perceived darker appearance. And then mixed type, which is basically a combination of any of those above. And for most individuals, there's usually more than one cause. So the most common is the mixture of pigmentation, vasculature, structural causes. So let's kind of dive into each cause and type and how to somewhat identify which one may be affecting and giving you the dark circle. So pigmented type, we tend to see this in general in individuals of color, and it can be a variation of normal. Darker melanin-rich skin tends to make more pigment, and sometimes that can run in families. Certainly, this type usually presents as more of a brown color underneath the eye, and there can even be like a little band, a rim of brown hue. Often, that can be made worse if there is an underlying condition that increases pigment production. So, for example, conditions like eczema, eyelid dermatitis, inflammation of the eyelid for whatever reason, extensive sun exposure, melasma, seasonal allergies that may cause you to rub your eyelid, and that rubbing over time can cause more pigment production. So all of those things can further contribute to melanin production, thereby worsen the appearance of dark circles. The second type, as I mentioned, is vascular type, and that often presents more of like a blue, pink, purple hue, and that is just the prominence of the blood vessels due to the thinner eyelid skin. And often this can be associated with puffiness of the lower eyelid. That puffiness can lead to more vascular congestion and thereby make the dark under eye circles more prominent. And this can be further compounded by certain lifestyle habits, right? So sleep deprivation is a classic one. Maybe eating salty food before bedtime that can cause more puffiness and thereby more congestion. And often there is, again, a genetic tendency in the sense some people just have more thinner eyelid skin than others, and that vascular prominence can be more noticeable. The third type is structural, and that basically is the contours formed by the facial anatomic features of our face. And some people have a more hollowing of the under eye, that tear trough area. We see this in younger people, but it can definitely become more prominent with age. With age, the aging process, we have changes in our bone and shifts of the fat in our face. And so that often structural changes, the structural cause is one of the more common causes for dark circles as we get older, and often a concern that we see that prompt people to come in to seek out certain cosmetic procedures such as fillers. And so certainly some individuals may have more hollowing that's their facial feature, but that can worsen with time due to the aging face. And lastly, I mentioned mixed type, which is often a combination, and certainly you can have, thinner eyelid skin, more prominent blood vessel, hollowing of your under eye that worsens over time. And so certainly you can have like pigmentation as well as vasculature, structural and pigmentation. And so for the most part, for most individuals, like I said, the cause is more than one. And how you can determine which may be the cause for you is a quick, simple test. It's not a foolproof test, but certainly can give you an idea of maybe what's causing your dark circles. Now, certainly if you have itchy eyes and your eyelid is red and flaky and inflamed, that is a sign of dermatitis. And certainly that can certainly be contributing, if not the cause, for the dark under eye circles. But if you are not sure and you just have dark circles, the skin around your eyelid looks normal, this is a test that you can perform at home. And what it is simply you just kind of use your finger and gently tug it slightly down with a little bit of firm pressure. And what that's doing is essentially changing the contours of your lower eyelid and how the light reflects off of your lower eyelid. So thereby, those individuals who have dark circles due to the structural cause, more the hollowing, the contours of the face, will notice an improvement in the dark under eyes. Conversely, individuals who have purely a vascular cause due to, congestion and more prominence of the blood vessels will actually not notice any improvement. And if anything, potentially worsening of the dark under eye circles because the pressure there is causing a decrease in blood flow and more vascular congestion. And similarly, with purely pigmentation, tugging down your eyelid skin, you're not really going to affect that pigment. So mostly there's going to be very minimal changes. So that's a simple test that you can perform. But like I said, for the average individual, the cause is more than one. Let's discuss how you can treat each individual cause. So for pigmentation, number one, you want to identify and treat any underlying inflammation, whether it's eyelid dermatitis, seasonal allergies. See your doctor for prescription medications. You need to get that inflammation under control. Otherwise, anything you do is really pointless because that melanin production is just going to keep going. So, prescription topical medications, dermatologists can prescribe to treat your eczema, allergy medications if you have that. And then you really want to look for products, eye creams with brightening properties to more gently, over the course of time, remove that excessive melanin. Now, obviously, prescription medications like hydroquinone, azelaic acid, and even topical retinoids can be helpful. Those are often very irritating. And when we're talking about the eyelid skin, if you're trying to tackle hyperpigmentation in a sensitive area, you really want to use that with caution. So ideally under the guidance of your dermatologist. But those are stronger prescriptions that can be used to tackle the excessive pigment. But if you don't have access to a dermatologist, I'm going to recommend a few eye creams here. So the first eye cream that I recommend is from Ole Hendrickson. It's the Banana Brighten Eye. And this one I really like because it's fragrance free. It has 3 different types of vitamin C that works well together to help brighten the pigment. And it's just a really nice eye cream. And I, in general, recommend if you can take eye creams that are fragrance free, especially if you have excessive pigment from contact dermatitis, because your eyelid skin is just going to be more sensitive in general. And fragrance, even though you may not have allergies to it, can just be a common additional irritant. The next eye cream I recommend is from Drunk Elephant, the Tango C eye cream. And this one is another one that I think is really nice. It's got various types of vitamin C along with soy and rice protein, which all have brightening properties, and peptides that can help to plump and also brighten and improve appearance of fine lines. A more affordable option you can consider is from Olay, the brightening eye cream that contains peptides, niacinamide, as well as vitamin C. That one, as well as their vitamin C eye cream, are very similarly formulated. So both contain niacinamide and vitamin C that are brightening ingredients that also can improve hydration and appearance of fine lines. Now, in addition to using eye creams that have brightening properties and treating the underlying inflammation, you also want to make sure that you're wearing sun protection, because we know pigment is worsened from chronic sun exposure and just in general sun exposure. So here it's mostly your sunscreen of choice. If whatever regular facial sunscreen you use, you find it working well for your eye area, it doesn't burn, doesn't cause irritation, by all means continue. One thing you can consider is using a specific eye cream with SPF built in that also have brightening properties. And I've talked about this in my other eye cream video, but one I really like is from Color Science, the Total Eye. Color Science Total Eye 3-in-1 Renewal Therapy. It is tinted and it's purely mineral based, and it's nice because it also has some of a brightening effect when it's applied onto the skin. It's got particles that kind of help reflect the light. So almost a little bit bit of a concealing effect as well. That also helps to protect against visible light in individuals with darker skin tone that may play a role with pigmentation, and it tends to be fairly well tolerated. Another option you can consider is using like an SPF stick. There are a couple that I've mentioned in the past, like from Ulta MD, as well as MD Solar Science, that have more of a dome shape that I think fits really nicely along the curvature and the contours of our lower eyelid as well as upper eyelid. The formulation, because of the wax-based nature for the sticks, they tend to stick to the skin better, thereby cause less irritation, and usually does not run as readily compared to regular facial sunscreen when you sweat. Okay, so we talked about pigmentation. Now, vascular cause. So really the best way to address that is temporary improvement with eye creams. Temporary mostly because there's really no way you can truly effectively improve with eye creams alone. The reason why is the eyelid skin is super thin. Certainly by using eye cream that helps to bulk up the eyelid area, like for example retinoids and peptides are going to be helpful, but eye creams in general are only going to help to a modest degree. This is where cosmetic procedures are going to be the more effective option. But certainly eye creams are still something that I think is really can be helpful. And so ingredients like peptides and retinol, that's going to work in building collagen to really improve the overall thickness of our underlying skin can be helpful. I've talked about this in my previous eye cream video, but for example, like Neutrogena, their rapid eye repair with retinol. Another one I have here is Rock, their retinol complexion. Both have great formulations of retinol that's very gentle, very well tolerated. Another one that is one of my all-time favorites is from Alastin Restorative Eye Treatment. This certainly is not cheap, but definitely have clinical studies that's shown that it does actually help with the appearance of dark circles. And this contains really a great blend of peptides that have demonstrated a strong efficacy in improving fine lines and wrinkles. And then the other thing is to consider to temporarily help improve the vascular prominence is caffeine. We know that caffeine vasoconstricts, and eye creams and caffeine I think are like a match made in heaven. And if an eye cream comes with additional like metal roller, metal tip, I think that's an extra bonus because it helps to really again massage, improve the lymphatics, the blood flow, as well as reduce puffiness. So one eye cream I really like is from L'Oreal, and this one is their Revitalift hyaluronic acid and caffeine. And I love this because it's got a metal tip on here that you can use to massage as you're applying. The hyaluronic acid helps to plump, and the caffeine helps to improve the vascular congestion. And the best thing about this is you can actually even put it in the fridge with that cooling effect. It can give you additional vasoconstrictive effects and that cooling effect to reduce puffiness. Another one, if you are more into like a primer or balmy like texture of an eye cream, is from MD Solar Science. This MD Restore Eye Gel. And this contains a blend of peptides, vitamin C, caffeine to again improve the temporary improvement of fine lines, wrinkles, helps to brighten with the vitamin C, and that caffeine can temporarily help to reduce some of the puffiness and vascular prominence. So those kind of help to a degree, but like I said, really the most effective thing is seeing a dermatologist or an expert in cosmetic rejuvenation and really assess to see whether you would be a candidate for under eye fillers, so tear trough fillers, and that those fillers can help to temporarily bulk up the skin underneath the eyes to kind of camouflage that vascular prominence. Now, not everybody's going to be a candidate, and so this is really where seeing an expert, someone who's experienced in doing this, can really make a world of a difference. But when it is done well in the appropriate candidate, it can really make a difference. If you're not a candidate for fillers, then certainly certain type of lasers can be helpful as well, but this is, again, as I mentioned, cosmetic procedures are going to give you way more bang for your buck than eye cream. Certainly these are, I think, helpful to use and can certainly improve the appearance of fine lines, wrinkles over time. But if you're looking for a quick, instant result, then in-office cosmetic procedures are the way to go. And similarly, addressing the last cause, which is structural, again, because it has to do with just the anatomic contours of your face. This is where really in-office procedures, surgical procedures, fillers are going to be really the most effective. Eye creams won't hurt, but certainly you're not going to get significant improvement. In addition to filling the under eyes, individuals that are experiencing experiencing darkening of their lower eyelid due to aging will often have improvement of the dark circles by really having what we call like a mid-face rejuvenation. So filling the mid-face to add volume to change how the light reflects off of your face can make a world of a difference. And I have had patients that I just went in and really filled and improved their mid-face volume and didn't do anything to their under eyes, and literally the before and after picture of their dark circles are very, very dramatic. So again here, the most important thing is seeing a provider who's experienced, who knows what you need to improve that structural contours to really improve the dark circles. All right, guys, so that is a very long explanation for a very common concern. I hope this video have helped shed some light for you on the causes of dark circles. And as you can see, there's really no straightforward answer. And so that is why when everybody asks me on social media, like, what is the best eye cream for dark circles? There isn't one, and it really depends on your personal cause. Again, I hope you find this video helpful. Let me know below if any of these eye creams that you have used that have helped with your dark circles. I would love to see what has worked well for you. And again, if you want me to do a more deep dive and product review of a particular eye cream, comment below and I'd be happy to do that as well. I would love it if you can give this video a thumbs up and subscribe to my channel, and I will see you guys next time. Bye.